on them, which are like little sharp things that stick out. So as they're moving down the urethra, they're causing severe pain because there are nerves in the urethra. And so as those kidney stones move through the urethra, they are like just scratching everything in sight as they come out.
She's probably had that for like 30 years.
I shook it too hard.
Okay, so here you see this bright spot, so that could be possibly a rib fracture. The spine is a significant uptake, so this is normal. And it's saying here that the knees are normal. I didn't pull up one that was great.
It's stuck here. She glued it.
Hey, Miss Elliott.
Maybe I find one that has cancer. Yes.
Is that baby skeleton there real?
Yes, it is.
It's like a baby cat.
I do that.
That baby skeleton.
Oh, she's a very dark twisty. Oh yeah, there's like a baby
How do you get one of those? Just like walk into a store. Hey, can I have a child skeleton? Preferably an infant. What? I'm joking.
It actually.
This is the bone scan, and those bright yellow areas are metastasized
She's really like
cancer.
250 years old.
She takes those suckers in.
Stem cell out of it, and then she's going to go for another 10 This one is really sad. All of those are metastasized cancer tumors.
Wow.
Bone cancer usually originates somewhere else, and then it ends up in the bone. And from what I understand, bone cancer is the absolute most painful kind of cancer you can get.
Do you think that man died?
Yeah.
Probably.
Yeah, this person pretty much, I'm sure, did not live long. So that's a bone scan. They also use bone scans to detect osteoporosis in women, menopausal women.
Literally the second page in the packet. We found out.
Okay, so here's our nutrient for Raymond, and then this is the blood vessel, and here's the spongy bone, so you can see how it just has that network of vessels in there. Anything else that I want you to remember about this? No. Bone growth. We're not going to get into a lot of this, but I do want to talk about the epiphyseal plate. You have an epiphyseal plate, which is an area of bone growth. This is where the bone is growing. And this is what it looks like as it's growing. So, at the ends of the long bones, in the epiphyseal area, you have cartilage. And that cartilage is being changed into bone tissue. And I'm not going to go through that because that's like a whole other chapter. But the cartilage cells are produced by mitosis on the epiphyseal side of the plate. The cartilage cells are destroyed and they're replaced by bone on the diaphyseal side of the plate. So tell me which is which. The epiphyseal part of the plate would be top or bottom? Top, and then the diaphyseal would be on the bottom. Okay, so the cartilage here is being replaced by bone tissue underneath. Between the ages of 18 and 25, this epiphyseal plate will close. In other words, no more cartilage exists and the bone will stop growing. Once that happens, you end up with what they call an epiphyseal line or epiphyseal scar. And that's how they know that you're not going to get any taller. Now, I had one of my students hurt her knee, went in, she had some cartilage damage, and then the doctor told her, and she was like 4'11", maybe. I know she wasn't 5 foot tall. And this was her sophomore year. She went in, and he said, well, I can tell you one thing, your epiphyseal plates are closed. She was like, what does that mean? He goes, you're not going to get any taller. And she was devastated, because she could barely see over the steering wheel as it was, and she hadn't even started driving yet. So, yeah.
Hey, in Texas,
she is probably in her 30s, and she has a daughter who is similar, and the daughter has started on growth hormone therapy, so that she's going to be taller. Actually, the second sibling, her husband is 6'6".
Oh.
And she's not even 5 foot tall. And the second daughter inherited the tallness from the dad, and she's 2 years younger, and she was like 2 inches taller than her sibling. And so they started the other one on growth hormone therapy. What growth hormone does, as long as that epiphyseal plate is still there, you can enhance the growth. Once the epiphyseal line or scar has formed, you can't, it's impossible to make that bone grow. Unless you undergo the dwarfism treatment, where they actually go in and they put screws in and they stretch the bone. Wow. Yeah. But the epiphyseal plates are closed. So if you go in and use hormone therapy, like the growth hormone therapy, you can actually cause the bones to grow longer. There's issues with that. It's very, very expensive. It's like, I want to say, I don't know how much it is now, but back then it was like $200 a shot, and you do a shot every day. And you do it for 2 years. Yeah, so it's pretty expensive, and back then it was considered experimental, and insurance won't pay for anything that's considered experimental. So it's out of your own pocket. The girl that I know that went through it, you know, Dr. Webb here in town, his youngest daughter, Kimmy, she went through growth hormone therapy. She was very, very short, and after measuring her hands, x-raying her hands, he could determine how tall she really should be. And so from that, they were able to do the growth hormone treatments, and she is about 5'6", 5'7" now. But now she's having some major issues in her back, because the bone growth was so quick that the rest of the body couldn't keep up, and so she's got some issues there. But anyway, so whenever you break a bone, especially when you're young, they want to make sure that it's not anywhere near the epiphyseal plate. Why? Yeah. If you damage those cells in there, those mitotic cells that are changing the cartilage to bone, if you damage those, they're going to stop working. And so the person, you can end up with a longer leg, one leg longer than the other, one arm longer than the other.
Oh, there's a question on that. I was confused. I'm like, I don't know. So that's
What were you going to say, Seth?
That's what I was gonna ask. Can you get like one leg longer than the other?
Yeah. So they're very, very particular about how they fix those kinds of breaks.
Is there any way to like stopping the growth in the other leg?
No, they would rather enhance the growth in the one that's damaged than trying to stop the growth in the other. Okay, so another thing, you know Mrs. Poteet? I had her oldest son in class, and he was probably, I don't know, maybe 6 foot tall, maybe. Probably more like 5'11", and he wasn't a very big guy. And 2 years later in college, he played played football at NSU. 2 years later, he came cheered up because he needed to do an internship in gymnastics as part of his physical education degree. And he walked in, and I didn't know who he was. Had no idea. He's like 6'5", and he's like 280 pounds, and he was like a man. You know what I mean? So that's what happens. You guys, sometimes, that's why I'm saying in men, this is closer to 25 before these stop. In women, it's more like 18. Some of you some girls in here probably have not gotten any taller since junior high, middle school. But some guys continue to get taller and taller and taller, and they may get 3 or 4 inches taller than what they were in high school. It's crazy. So, anyway, that's why. Okay, so what affects bone growth? Well, your nutrition for one thing. Adequate levels of minerals and vitamins in your diet. Calcium and phosphorus, you have to have these. You get this in milk. You get it in dairy products. You can take supplements. For young children that don't get enough calcium and phosphorus in their diet as little kids, their bones aren't mineralized enough. And if you see pictures, they look bow-legged. And that's called rickets. And that's what it's from. And if they get too old, it's irreparable. And I have pictures on all this, but I'm going to get through the notes and I'll show you pictures tomorrow. You got to have vitamin C to make collagen. You have to have vitamins K and B12 for protein synthesis. You have to have specific levels of, or sufficient levels of, insulin growth-like factor or hormone, growth hormone. That's going to promote cell division at the epiphyseal plate. You need thyroid. Sex steroids at puberty are necessary, like estrogen, progesterone, and testosterone. Those are all necessary for this to happen. Oversecretion of human growth hormone during adolescence will result in giantism. If the person gets too much growth hormone being secreted, those epiphyseal plates do not close, and they just keep getting taller and taller and taller. And you will see this a lot in basketball players. The basketball players that are 7 foot tall, this is usually why. They had an abnormal secretion of human growth hormone during childhood. Now, under-secretion is going to produce a short stature. These are not midgets, and we don't use those. We don't use that term. That is not politically correct. They're not called dwarfs. They are called little people. No, they are called dwarfs. I'm just kidding. But they do not fall into this category. That is not what's wrong with them. Are you listening? That is not what's wrong with them. Dwarfs are, this is hereditary. So there's 2 different kinds of dwarfism. We get into a lot of this when we do the endocrine system. That's my absolute favorite system.
Wait, but what's the 2 different types? I just want to know real quick.
Achondroplasia, and I can't remember the other one.
But one of them's hereditary and the other one's...
They're both
And
hereditary.
bite size.
I was like, oh.
Can 2 dwarfs have a normal size child?
Yes.
Yes.
How does that...
I seen it on TLC.
It's a recessive.
Just try. Have that intent look on your ISD. You gotta take this much test. Oh no.
What?
Both men and women who lack
Hey, what?
estrogen receptors,
What?
believe it or not, men do produce estrogen.
Tempting.
Those that lack the receptors on cells will grow taller than normal. Estrogen is responsible for the closure of growth plates. If you don't have the receptors that the estrogen attaches to, then the estrogen is just usually reuptaked or put out in the urine. It's not used, and so therefore they just keep getting taller and taller. If you have the receptors, then estrogen is what closes the growth plates. And so this is when females start going through puberty and they start increasing the levels of estrogen, this is when they start stopping in their growth. Bone remodeling. I've talked a little bit about this. Fractures and repair. Fracture is a break in a bone. What is the other word that people use? I think it is fracture and break.
Yeah.
It's the same thing.
It is?
Yeah.
If you fracture a bone, you have broken the bone. There is not, I don't know why people think fracture is something different.
I thought there was
Right.
like
I think when people think of break, they think of like.
Now, if you're
Yeah.
talking, there's different kinds of breaks.
Yeah.
There's incomplete and there's complete. So a complete break would be where the bone is completely broken into two pieces. Incomplete break is where it's not. Now, they're also talking about whether the break was completely inside the skin and muscle or whether it goes outside the skin and muscle. And those are called open and closed. If you have an open fracture, when the bone breaks, it goes outside the skin. Those are, you don't want one of those. Those are awful because you can get infections so easy and the blood is just going everywhere. Closed fracture, you still get the blood, but it's all kind of contained and you don't have outside things that can get in.
Did you really?
Notice that healing is faster in bone than it is in cartilage because cartilage doesn't have blood vessels. Bone does. So if you tear your cartilage, it would have been better just to break your bone. Seriously. Because bones heal faster than torn cartilage. It's still slow, but it's faster. Closed reduction. I think you saw this on the video where the guy used his foot to like manipulate the bone. Yeah, well they don't quite do that anymore, but that's closed reduction. That's where they don't want to do surgery on it and they want to just try to manipulate it and get the pieces back into place. Or open reduction is where they're going to do surgery on it and they usually put in pins or plates or screws. Okay, here's the different kinds of fractures. I know that this picture is on your test.
Cool.
An open fracture, as you can see, it's completely broken and this is going outside the skin. I'm trying to remember, they used to call them something else.
Compound.
Compound, yeah. Compound fractures, they don't use that term anymore. Let's see if it gives a description of these. Okay, a comminuted is the broken ends of the bones are fragmented. So here is this break. I think I put that picture in your notes, didn't I? This picture's in there somewhere.
I think it's in
Maybe the last page or somewhere in there.
I think it's in our prayer.
Yep. A green stick. This one's kind of cool because if you have like a branch on a tree and you go and try to break it and it's still alive, it just bends, right? Well, there's parts in there underneath that bark that probably has broken. In children, their bones still have a lot of cartilage in them. So when children break bones, a lot of times it's called a green stick fracture. Like it'll twist or it'll just break one side of it. And that's mainly due to the cartilage that's still there. And impacted, that's where the bone, like, well, a femur will do this, some of your lower leg bones will do this as well. And it's where the impact has come this direction and the bone breaks, but it just jabs down into the bone itself. And here they're showing, here are the femurs that's done that. Yeah, causing a lot of issues too. A Pott's fracture. A Pott's fracture is where you turn the foot inward and you break this outer bone right there at the ankle. This is common in skiing. In snow skiing, this is a very common fracture. A Colles fracture is very common in falls because the first thing you do is you put your hand down when you start to fall and you snap that right there. So does it have to be like
I think that's what
His demands are just walking.
it's usually in that area.
Snap.
Looks like it.
Does it have to be then like lower wrist?
Yeah, usually Colles is. But I mean, you can break the bone farther up in a fall like that. Stress fracture, these are microscopic fissures from repeated strenuous activities. You see these a lot in runners. They're pounding the heel, pounding the heel, pounding the heel, and you get little minute little fractures in there, and they call those stress fractures, and if you don't allow it time to heal, you will probably end up breaking a bone. And speaking of breaking bone, I have a picture.
Oh, that's so short.
10 minutes.
Yeah, it's not like I have 40 minutes of video on my phone right now.
Okay, so this young lady
Really?
recently graduated from college. You guys all know her. She was a cross-country runner here, and she started out with a stress fracture in her lower leg, and she kept running, and she broke it before the finish line. And so they had to repair it. So this was her break, and that's a nasty break. They had to go in and repair it with screws and plates. When they took the cast off, look at the difference in her leg muscles. Yes, this is atrophy. This is disuse atrophy. And that's what happens when you're in a cast, because you're not using your muscles. So I'll pass that around and you can look at that.
I think it's just
That is not
Ryan broke his foot.
a stress fracture. Okay, that is a true fracture. I'm just saying that it started as little stress fractures, and then when she ran super hard at the finish line in cross-country state, that happened.
Did she win?
No.
It was the only time she didn't win in the 4 years of high school.
State.
Okay, so let me just say this, guys. I know I've been going and you've been listening and you've been great, but this is very important. Calcium homeostasis in blood tissue. If you do not have enough calcium in your bloodstream, your muscles are not going to contract properly, especially the heart. So this can become an issue. So your body naturally undergoes this homeostatic mechanism because it's going to do whatever it can to make everything normal, right? And if that means taking all of the calcium completely out of your bones to make sure that there's enough calcium in your blood, it's going to do it. So it's saying that calcium ions are involved with many body systems. For example, nerve impulses and muscle cell function. Blood clotting. Your blood's not going to clot without calcium. It's not going to happen. Enzyme function and many of your biochemical reactions. A lot of things that are going on in there need calcium. Even small changes in your blood levels of calcium can be deadly. If the blood calcium levels are way too high, your heart is going to stop beating. If they're way, way too low, your heart's going to stop beating. So it's very important to maintain those levels. Also, respiratory arrest can occur if they're too low. So how does this work? Well, like I told you, those osteoclasts will break down bone tissue and put calcium into the bloodstream. On the other hand, what if there's too much calcium in the blood?
You make more bone.
What happens when there's excess calcium? Does it just put it out in the urine?
Probably not.
No, it lays it on bone. It just makes the bone thicker. And that happens through
Genesis.
osteocytes.
Oh.
Osteocytes will continue to lay down the matrix that will help do that. Okay, exercise and bone tissue. When you exercise, it makes your muscles heavier. When your muscles are heavier, they are putting stress on the outside of the bones, and that helps the bones stay compact. That's a good thing. As you age and you lose muscle strength, the bones have a tendency to not have that pressure on them, and they tend to, I want to say disintegrate, but they tend to lose calcium faster. So you want to make sure that you exercise, keep your muscles strong so that they put pressure on the bones. That stress on the bones increases the deposition of mineral salts and the production of collagen. This lack of mechanical stress will result in bone loss. And you see this also reduced activity while in a cast. It also changes your musculature. Astronauts that are at the space station and they're there for 9 months, there's no gravity. There's no pressure at all on their bones. So what do you think is going to happen to their bone tissue?
Muscular degeneration.
They're going to have degeneration of bone tissue. That is correct. Now, there are things up there they have to exercise and do things like that to increase their bone mass. But as far as having any gravity on them, there's not. So they'll lose up to 4%, if I'm not mistaken. They say.
Like the people in Wally.
Huh?
Like the people in Wally. I know it's like totally fictional, but
I don't know where that is.
What?
it's a movie where like Earth is abandoned and we all live in space for like hundreds and hundreds of years.
Have you not seen Wall-E?
Like the 100, where the kids come back to Earth.
also a thing.
That's great.
Yeah,
No idea.
Okay. People who are bedridden and they can't use their muscles, they will also lose bone mass because of that. Demineralization of bones occurs in women rapidly between the ages of 40 to 45 as estrogen levels decrease. In males, it usually doesn't begin until after age 60. Osteoporosis, you need to know about this. Osteoporosis is the decreased bone mass resulting in porous bones. So the compact bone that's supposed to be nice and solid starts getting holy. That's with an H, not with a W. Those people that are at risk for osteoporosis are white, thin, menopausal, smoking, drinking females with family history of it. Athletes. This is important. Athletes who are not menstruating, obviously these are women, due to decreased body fat and decreased estrogen levels. Cross-country runners. For a lot of women who are cross-country runners or they run a lot of marathons do not have periods. And it's because their estrogen levels are too low. There's no fat, and that's what estrogen's stored in. So if you don't have any body fat, you're not storing estrogen, and there's no estrogen, then the cycle doesn't occur. People who are allergic to milk, or they have eating disorders, whose intake of calcium is too low. People who are anorexic obviously don't take in enough. People who are bulimic take in a whole bunch, but they throw it all up. And when they throw it up, they're throwing up stomach acid along with that, and it tends to eat away the back of the teeth. It also causes a lot of issues with their hearts. Have you ever heard of the Carpenters? The brother and sister singers back in the 70s. She had an eating disorder. She was bulimic, and she died of a heart attack, and she was like 30. Prevention of osteoporosis. I'm doing this because it's an essay question on the test. Adequate diet, weight-bearing exercises, estrogen replacement therapy. Nowadays, they don't really like to do this because they say that it increases your chances of breast cancer. But it used to be part of it. Behavior when young may be the most important factor. So start early. I think I'm done.
With a